Hi there, it's Dr. Kathleen Cannon, and I'm here on a Saturday in my workout clothes doing a little work, and just wanted to mention one of the most common questions that I get asked. Every week I get asked this question at least once, if not more times, and that question is, what is the most common thing, condition, or disease that you treat people with? Or even symptom. Basically, what's the most common thing that you see in your office? And it's a really great question, and it's also a really challenging question to answer in some respects because there is no one common thing. I see people with a whole bunch of different health stuff going on, and there's lots of different factors, lots of different conditions, and overlapping symptoms, diagnoses that may or may not be clear. So it's a challenging question, but one of the, and of course I answer it and we talk through, the most common sorts of conditions and the most common types of presentations that I see. And so part of the answer to that is, related to energy, fatigue, hormonal types of concerns, cardiovascular types of concerns, neurological types of concerns, certainly digestive concerns. There's so much in each of these categories, and that's just kind of touching the tip of the iceberg there, because there are a lot of other conditions that I also see a lot. So it's not a straightforward answer. However, the most common thing that I would say I see is people who would love support with their health, and so that's what I really try to provide. But one of the more common, and especially for people over 40 and over 50 and looking for pro-aging and preventive care, long-term health goals, one of the most common things that we work on there is cardiovascular health. And why is that? Well, we all know that the heart is kind of traditionally said to be one of the most, if not the most important organ. We know that all of the organs in the body are important in different ways and they all work together. So it's not that just one is the most important, but a lot of people know that you need the heart to beat. If it doesn't, then things are going to kind of stop in the rest of the body. So the heart is very important. The cardiovascular system includes the heart, but it's also all of the blood vessels, all of the big and the little channels that carry your blood throughout your body. And why that's important is because your blood is like the highway in your body. The highway and the roads, it's kind of like how the mail gets delivered everywhere. But your blood is delivering nutrients and oxygen everywhere throughout your body, and it's also helping to remove the waste from places where oxygen has already been used up, and there's a whole lot of other stuff that's transported in your blood also. But the blood is a super, super important part of your body. The blood is actually a living, moving tissue. We think of it as a liquid. We don't think of it as a tissue all the time, but it actually is a tissue. Your blood is a tissue in the body. So your cardiovascular system, which again is your heart, and then all of those blood vessels, the vasculature. So that's your artery and your arteries and your veins and all of your microvasculature in your body. Super duper important. So prioritizing your cardiovascular health, especially as we age, is really, really big, and that's one of the more common things that I work on with people in all different ways, depending on the person and their health and their risk factors and their goals. All right, I hope this has served you. Have a wonderful day.